The research team for the Ontario Child Health Study is based at the Shadot campus of McMaster University in Hamilton, but we represent over 45 co-investigators from across Canada and the States. The study also received funding from the Canadian Institutes of Health Research and the Ministry of Health and Long-Term Care in Ontario.
So the 2014 Ontario Child Health Study, or what we like to refer to as the OCHS, is an update to the 1983 Ontario Child Health Study that was conducted by Dan Offord and Michael Boyle and colleagues at McMaster.
The 2014 OCHS is a far more complex, ambitious and large study relative to the 1983 OCHS, in which the primary goal of the 2014 OCHS is to help us better understand how we can improve the lives of children and youth in Ontario by collecting up-to-date information on child health and development. The 2014 OCHS has 5 broad objectives. The first is to determine the prevalence of child mental disorder among children and youth between the ages of 4 and 17 years in our province. The second is to examine the extent to which mental disorders have gone up in comparison to 1983. Are more children today suffering from a child mental disorder in comparison to 1983? And to examine the extent to which income inequality is having an impact on child and youth mental disorder, now and in comparison to 1983. The third broad objective is to examine the extent to which our healthcare system is responding to the healthcare needs of children and youth with a mental disorder. The fourth objective is to help us better understand the burden of suffering associated with child and youth mental disorder and a chronic physical illness. We know that many children suffering from these conditions often have difficulties at home with their families, in their schools and in their neighborhoods. We hope that the 2014 Ontario Child Health Study can help us better understand the nature of those difficulties so we can help these children and their families better. The final objective of the 2014 OCHS is to help us understand environmental influences on child and youth mental health. The key environments of interest to us are the child's family, the child's neighborhood, and the child's school. And we hope that the 2014 OCHS will help us better understand the ways in which these environments can influence child and youth mental health to help us develop interventions and programs that can be implemented within these settings.
We have 3 basic reasons for wanting to do the study at this time. First of all, we are concerned about resource allocation, the allocation of funding to programs and policies in the province. In order to make sort of rational decisions about these allocations, we really have to get a better understanding of levels of mental health need in the population and the link between these levels of need and responsiveness of the healthcare system. 30 years ago, we identified and had very serious concerns about both the high levels and the inadequacy of the system. We want to see if things have changed over that 30-year time period. Second, we are interested in social justice issues, and the old chestnuts of poverty and income inequality are issues that we want to address carefully in this study. There's been growing income inequality in this country, in the UK, the US, for the past 30 years, and we're concerned that it's had serious effects on children's mental health, and we want to look to see the extent to which that's the case or not the case. Because in the interim, governments, as noted before, have provided a lot of resources to programs and policies in order to offset the adverse consequences of poverty and income inequality. Finally, and this is, I think, a reason close to our hearts, we want to look at environmental influences. What do we mean by environmental influences? Well, we're going to look at families, we're going to look at neighborhoods, and we're going to look at schools, and we're going to look at opportunities within these contexts to see if we can introduce programs or policies that will either prevent mental health problems in the future for children or successfully intervene and reduce the ill consequences associated with mental health challenges that kids are having. We think at this time that these environmental influences are the way to go. Governments don't have much feeling or commitment towards changing income inequality itself, attacking that head on. So we have to count on our environmental influences to mute the adverse impacts of poverty and income inequality.